Back-to-school shopping used to be backpacks and computers. Now, for many teenagers, it's a nose job or breast implants. According to a recent study by the American Society of Plastic Surgeons, the number of teen plastic surgeries increased 30% during the last decade. Here to talk to us a little bit more about why that might be happening is cosmetic surgeon and women's health expert Dr. Dave David. It's nice to see you again, and it's nice that you have that name. It's easy for me to remember.
I know everybody says that. It could be good or bad, you know.
When our kids go back to school this year, there's a possibility that there are going to be some of their classmates who are going to look a little different.
Yeah, that is true, Kim, and it's been going on for a number of years now. There is an increasing trend in plastic surgery for teens and also just for cosmetic procedures, even non-surgical, and it's just going up and up and up.
Now, why do you think these teenagers are having more plastic surgery?
Well, you know, a lot of reasons, Kim. I think one of them is the peer pressure you see on TV. Excuse me, you used to always hear that, you know, the pressure of models being so skinny and everybody else has to be. But I just think it's cosmetic surgery in general is becoming more popular even with adults, and when that happens, that gets brought down with the kids.
Sure, starts to trickle down, doesn't it?
Yeah, and the bullying and different things, and just kids teasing each other more, and people looking for perfection. You know?
What procedure are you seeing most being done on teenagers?
Well, actually, interestingly, the most common procedure requested and actually performed last year on teenagers is a nose job, believe it or not, a rhinoplasty.
Really?
Second, which is about maybe 13,000 others, is male gynecomastia, or male breast reduction. And now, of course, with the minimally invasive liposuction, like even the kind that I do, it's great and it's easy, but that's the second most requested. People would think breast augmentation
Absolutely.
That's actually third and tied with ears, with pinning the ears. I mean, who would know? Who would think that?
Absolutely. You know? Now, does a teenager have to have permission from their parents to have this done?
Well, you know, it depends what you mean by teens. Remember, teenagers is really 13 to 19.
Right.
18 and above, you don't. Just like any medical treatment, you don't have to have your, you know, parent's signature if you're over 18. But under 18, you really do.
Are there any circumstances in which you think this is a safe idea?
Yeah, and I mean, surgery nowadays is safe anyway. The risk to the teenagers is not much more than that to adults. If you ask if I personally recommend cosmetic surgery for teens, no, I don't. And for the most part, if I had to give a blanket yes or no, I am against it. There are situations where it can be beneficial, though.
Okay, and let's talk about those. When are those?
Okay. Well, you know, I think if, unlike a teenager just wanting to look better, oh, you know, I just want to look better and compete with my peers. If they have something disfiguring, I mean, really oddly disfiguring, a really odd birthmark, a very, very, you know, distorted facial features, that's different. Or something they're born with, something congenital, you know, that's different. But I think just because they want bigger breast or a little nicer, more perfect face.
Liposuction because they don't want to exercise.
Yeah, I mean, and liposuction is not a weight loss motivation, but nowadays we've got this cool sculpt by Zeltique, which is non-invasive way of losing fat. You know, you can just freeze the fat from the outside, non-surgical. That would be a better alternative than going, you know, something surgical in teenagers.
Absolutely.
You know, they need to finish their development as far as even the breast augmentation, because they're going to develop more between 18 and 21. The average girl will have, you know, enlarged. So a lot of changes still in the body.
Right. Well, you answered my next question, which was going to be,
I read
you know,
your
you did. It was very impressive. Which was going to be, you know, there's some physical issues that teens are still dealing with, so they need to wait.
Absolutely, yeah.
All right, terrific. Great to see you. You have some great ideas here and great advice for parents at home who may be thinking about that for their kids.
Great to see you again, Kim.
You too.